Hey, welcome back to our channel. Have you ever wondered how therapy really works? Does it actually lead to positive change, or is it just a waste of time? In this video, we'll explore what happens during therapy, why it's effective, and why it sometimes fails. Let's dive into the world of mental health and find out together. What is therapy? Before we dive into whether therapy works and why, it's important to understand what therapy actually is. Therapy, also known as psychotherapy or talk therapy, is a structured process that involves meeting with a trained mental health professional such as a psychologist, counselor, or social worker. During these sessions, you'll have the opportunity to discuss your thoughts, feelings, and behaviors in a safe and non-judgmental environment. The ultimate goal of therapy is to help you recognize and change negative thought patterns and behaviors while processing emotions and building healthier coping strategies. Therapists use various evidence-based techniques tailored to your unique needs, which we'll discuss shortly. So now that we know what therapy is, let's discuss why it works. Therapy provides a safe, non-judgmental space where you can explore your thoughts and emotions without fear of criticism or shame. This secure environment helps you uncover and understand underlying issues that may be contributing to your emotional or behavioral problems. By creating this safe space, therapy allows you to confront your challenges and develop healthier ways of coping with them. Therapists are trained to use evidence-based techniques such as cognitive behavioral therapy, psychoanalysis, or mindfulness to create real change. For example, cognitive behavioral therapy, CBT, helps you identify and change negative thought patterns that lead to problematic behaviors. Psychoanalysis, or psychodynamic therapy, explores your unconscious thoughts and feelings to understand how they influence your current behavior. Mindfulness-based therapy teaches you to be present in the moment and manage your emotions more effectively. These therapeutic techniques are backed by research and have proven effective in helping people overcome various mental health challenges. One of the most crucial elements of therapy is the relationship between the therapist and the client, often referred to as the therapeutic alliance. A strong therapeutic alliance is built on mutual trust, empathy, and understanding. When you have a positive relationship with your therapist, you're more likely to be open and honest about your struggles, which is essential for making progress in therapy. Your therapist's empathy and understanding create a supportive environment where you feel comfortable sharing your thoughts and emotions without fear of judgment. This collaborative relationship allows you to work together towards achieving your therapeutic goals. Now that we know why therapy works, let's discuss why it sometimes fails. While therapy can be highly effective in bringing about positive change, there are instances where it might not work as expected. Here are a few reasons why therapy sometimes fails. One reason therapy might fail is when there's no strong connection between the therapist and the client. As we mentioned earlier, a positive therapeutic alliance is crucial for success in therapy. However, sometimes there might be a mismatch in personalities or approaches, which can hinder the development of a strong connection. If you don't feel comfortable opening up to your therapist, or if there's a lack of trust, it can be challenging to make progress and achieve your therapeutic goals. Another reason therapy might not work is when there are unrealistic expectations. It's important to have realistic expectations about the process and outcomes of therapy. Some individuals might expect immediate solutions to complex problems, or might not be prepared to invest the necessary time and effort into the therapeutic process. Therapy requires active participation, self-reflection, and a willingness to confront uncomfortable emotions. If you're not prepared to engage in this process, therapy might not be effective in addressing your concerns. Furthermore, therapy might not work if the client isn't ready for change. Sometimes individuals are not truly ready or willing to make the necessary changes to improve their situation. They might not be motivated to overcome their challenges, or might not see the need for personal growth and change. In such cases, therapy might not be successful until the client is genuinely ready to work on themselves. Finally, therapy might fail if the chosen method doesn't fit the person's needs. Different therapeutic approaches work differently for different people. What might be effective for one individual might not be suitable for another. For example, a highly structured approach might work well for someone who appreciates clarity and direction, while a more person-centered approach might be better for someone who needs more flexibility and autonomy. It's essential to find a therapist who can tailor the therapeutic approach to your unique needs and preferences. Now that we know why therapy sometimes fails, let's talk about how to make therapy work for you. To make therapy effective, it's essential to take proactive steps to ensure a positive and successful experience. Here are some tips on how to make therapy work for you. Firstly, be open and honest with your therapist. Building an open and honest relationship with your therapist is crucial for success in therapy. Be honest about your struggles and avoid hiding or minimizing your problems. By being vulnerable and sharing your true thoughts and feelings, you'll create a strong foundation for a trusting relationship with your therapist. Remember that therapy is a collaborative process, and your therapist is there to support you in your journey towards healing and growth. Find the right therapist and approach for you. Finding the right therapist can significantly impact your therapeutic experience. Don't hesitate to try different therapists until you find someone you feel comfortable with. Consider factors such as their approach, experience, and areas of expertise to determine if they are a good fit for you. You might also want to explore different therapeutic approaches such as cognitive behavioral therapy, CBT, psychodynamic therapy, or mindfulness-based therapy to find what works best for you. Set clear goals for therapy. Setting clear goals for therapy can help you stay focused and motivated throughout the process. Discuss your goals with your therapist and work together to develop a treatment plan that outlines your objectives and the steps you need to take to achieve them. Having a clear roadmap can help you track your progress and celebrate your achievements along the way. Give it time. Real change takes time and patience. Don't expect immediate results from therapy. It's essential to be patient with yourself and the process. Healing and personal growth take time, and it's crucial to allow yourself the space to work through your emotions and develop new skills. Trust the process and believe in your ability to make positive changes in your life. Therapy can be a transformative experience, but it's essential to understand how it works, why it sometimes fails, and most importantly, how to make it work for you. By following the tips we've discussed, you can enhance your therapeutic experience and increase the likelihood of achieving your goals. If you've ever tried therapy, we'd love to hear about your experiences in the comments below. Your stories might resonate with others who are considering therapy and help them in their journey towards mental wellness. If you found this video helpful, please give it a thumbs up to show your support. And don't forget to hit the subscribe button to stay updated on our latest videos. We release new videos every week, so there's always fresh content for you to explore. Thanks for watching. We'll see you next time.